Hi, everybody. Welcome to week 7 of your practicum course. We are moving right along. So, this week we're talking about curriculum design and curriculum evaluation. And this can relate to curriculum in the academic setting, curriculum in the clinical setting, and it can relate to, in the clinical setting, maybe new grad curriculum. It can relate to specialty curriculum. There's all sorts of places where we put together curriculum for nursing staff, right? Continuing education pieces, that sort of thing. Okay, so when we think about curriculum, it can be very exciting to develop new curriculum, but it can also be, oh my gosh, incredibly challenging, right? Because you have all these stakeholders, you have all of these various standards. If you think about, you've got your accrediting body, like the NLN or AACN, whatever that might be. In the hospital, maybe you've got Joint Commission as your accrediting body. In a nursing program, you've got all the different standards from different nursing organizations, the Oncology Nursing Society, I'm spacing on the name right now, but the Women's Health Organization. There's so many stakeholders. And then we've got our students. We want to give them a good product. We've got their potential employers. We've got whoever's paying for these educations. I mean, there's just so many stakeholders. And then you've got all these threads that you're trying to infuse through the curriculum. And so curriculum tends to get out of control, okay? So because there's always something new in healthcare, right? And so you start specializing in a course and you learn all about it and you want to add all the new and latest and greatest. And pretty soon there's just no way students can retain any of that information. It's just total information overload. And so that's when we really started looking in academia at concept-based curriculum. And some of this can apply to the clinical setting also. But in concept-based curriculum, we would look at running concepts through a course. So a concept might be oxygenation or perfusion or integrity, professionalism, patient education. So those concepts would run through. For instance, let's say I was teaching an upper level med-surg course or something on that area, okay? And this is kind of similar in the hospital. Instead of teaching students how to take care of a stroke patient, a Guillain-Barré patient, an MS patient, I'm going to start teaching students how to view a neuro patient. You have to understand the basic physiology and pathophysiology on the cellular level to start with. If you don't understand that, then the rest of it's going to go to heck, right? And then what are the critical factors when I'm taking care of a neuro patient? What are the critical assessment pieces? What am I always going to look at? What is critical about just taking care of a neuro patient? And then we started using exemplars, okay? So then we're going to study like 3 different examples of types of neuro patients. But we're getting somebody to kind of critically think about, okay, this is a neuro patient. How do I look at neuro patients versus memorizing all the little teeny things of how I take care of each neuro condition? And that leads to critical thinking and the big picture. So concept-based curriculum is expanding to many programs. Some people are adopting it on a smaller basis and some on a launch basis. Some of them in academia put concept-based curriculum through like what we would normally call maybe foundations or fundamentals, med-surg 1, med-surg 2, critical care. They might run concepts through those, but still leave OB, peds, psych, community. Maybe community would have those too. Others take the concept and let's say they have year 1 foundations across the lifespan. And so they would look at the more simple cardiac conditions, taking care of a relatively stable cardiac patient, maybe the chronic conditions. But they would go from peds to geriatrics. That's a really different kind of way of teaching. And so if you do find yourself in a program that's more concept-based, it's just a little different perspective of looking at that. If any of you went to school in a concept-based program, I'd love to hear about that. The other piece I just wanted to talk a little bit about is the different types of curriculum, and I'm going to attach some information about getting spots on my glasses. Yeah, they're still there. Sorry about that. Different types of curriculum. The written curriculum, the tested curriculum, the hidden curriculum. And we touched on this just a little bit when we were talking about the different domains, cognitive, affective, psychomotor. So what we test on, we are saying that that's the most important stuff, okay? So when we talked a little bit last week about maybe affective, that domain not being as discussed enough, are we really saying by testing cognitive and testing psychomotor, but not really testing affective so much, are we in fact saying our philosophy is that affective maybe isn't as important? And there's this whole discussion about what you test, what you measure, what you emphasize. Even if you teach a broad spectrum of things, those are the things that you're saying are the most important. Anyway, I'm going to throw up a real quickie little article attached to this and see what you think about it, about the different types of curriculum. Okay, so week 7, I'm going to be reviewing the NEPDs that you just turned in. And if you're following a normal trajectory of your practicum and you're about halfway through, then I'm hoping to see your midterm evaluation. Remember, if you're not halfway through your hours, once you get there, then that's when you have your your preceptor fill out that evaluation form and upload it. All right, I think that's the big stuff I wanted to share this week. I'm looking forward to seeing you in the main forum.